concentrate today's one very short lecture on how to defend properly. The problem with you, with your students are when you come into us, either you are in a panicky mode, or you come in with a siege mentality that we're going to try to fail you. Actually, we are not. We are there to try to help you pass. Okay, and nobody is sitting there trying to poke holes or trying to find where you make mistakes. However, if you have made mistakes, unfortunately, and that has not been corrected, then I think we are trying to be as transparent as possible. But if there are mistakes, then there are mistakes, and it's good that if you take either 2 weeks or 6 months or whatever time necessary to clear up the mistakes, right? So my first advice is, don't come in with a siege mentality. Don't come in thinking that we're trying to fail you. We are trying to help you, and let's work together on this. Okay. So before we start the defense itself, there are a few prerequisites. First and foremost, discussion with your supervisors is very, very essential. A lot of you come in, and sometimes your supervisors, your senior supervisors, don't really know what you're talking about, or what you have actually presented. Please do attempt to present to them, to get their feedbacks and to make the corrections necessary before you come into us, right? I mean, not just discuss, you must also have their approval before you come in. Number two, you must come in with a soft copy. You don't need to have it bound or anything. You just have to give us a soft copy of your thesis. And we want a complete thesis. This completed soft copy must have a correction of your previous comments, right? Which we have given you in your various years, in your first year, second year, third year, whatever it is, okay? And finally, you must have a Turnitin report. You must bring your full Turnitin report with you when you come in for your presentation, final presentation. Okay, the presentation itself is only 7 minutes, and this will be followed by an average of 7 to 8 minutes of Q&A. Okay, we have due to the varying quality previously, Prof Kun Leong and Prof April decided that we would stick with 5 senior academics who have got vast experience in research, who will be sitting down. So it's going to be the same panel which sits down for the final years. This is specifically for the final years. This is nothing to do with the second and third year evaluations. Okay, so you will have 5 senior academics who sits down and who evaluate and mark it together. Okay, so let's start with the defense itself. I told you you only have about 7 minutes. In 7 minutes, a reasonable number of slides is about 10 to 14 slides. Anything more than that, you're going to either rush through, or you're going to skip a lot of information. So try to stick to this 10 to 14 slides. That's all you need, because you must remember, you've already presented your proposal to us, you presented your sample size to us, you presented your literature review. You don't need to go into detail. Okay, so start your first slide with your title. And the title must be a very clear title. It must tell what kind of a study is it. Is it a randomized control trial? Is it a prospective cohort study? Is it a survey analysis? Is it a validation study? What exactly are you doing? Okay. And then it must contain the actual objective, which is determine the outcome of laparoscopic hernia repair, etc. You preferably have when and where you're doing it in the title. So if it was done in UMMC or in the Ministry of Health, and between 2018 to 2020, whatever it is, that these are the information we want to see in your title. Okay, and the title page must also contain your name, your matrix number, year of study, supervisors. These are the main things you need in your title page. I've already mentioned this. It's a 7-minute presentation, 10 to 14 slides max. You can have multiple backup slides. Let's say we ask you further information. You can come prepared with extra slides which contain details of your sample size, which contain further analysis or literature review of some sort to back you up. So you can have all the backup slides. You don't have to present it unless you're questioned about it. Make sure your slides are in simple sentences with relevant information only. Remember, you do not try to kill people by PowerPoint. Okay, don't put so much of information within the PowerPoint that after a while we just lose track of what is on the slides. Okay, and it must be relevant to your year of training and year of study. So in your final year, it must be the final assessment. We have already given this to you before, where we have told you in the first year, we wanted you to tell us about your topic of interest, the research question, and then in the next evaluation, we want a project proposal, methodology, feasibility, literature review, ethics, and sample size. So by your second to third year, you should already have your literature review, ethics, and sample size approved. The subsequent third year should be spent on data collection. And finally, your final presentation should be the results and analysis. So based on this, if you have already been approved on literature review, ethics, and sample size, it is unlikely that we're going to go back and ask you questions about your sample size again. I mean, we might ask to understand how you came up with your sample size, but you will not be criticized for sample size at that point if this has already been approved and you have defended yourself well. Okay, so concentrate on your actual results and discussion. Okay, the next slide will be your introduction. Be very brief, be simple. Give us a bit of background about your study. Tell us what the problem is. Tell us what is already known about the problem. Okay, and what do you think is unknown and can be improved. And finally, tell us how you want to achieve this. These are the only 4 questions you have to answer in your introduction. Okay, if you tell me these 4 things, you have already covered everything you need to in the introduction. What is the problem? What is already known about the problem? What is unknown or what can be improved? And how do you want to achieve this? The literature review should be as brief as possible. Don't give me all the literature you've studied, your 300 different papers. That's not what a literature review is. It's short, it's summarized, it's specific to your objectives and your problem statement. Okay, so you want to tell me, you want to put it up in a simple table form. You tell me which author, what is the short title, what is the design of the paper, and what is the specific data, data 1, data 2, and your own comments, and give us the most relevant papers. Don't give us everything. Again, we don't really have time to sit down and look at all the various literature you've collected. So be very specific about this. Great. Next, the research question. This must be very clear. What is the problem you want to investigate? And you write the problem as a simple question. Your question should be why. The research question is you want to know what are the factors that affect surgical skin infection in laparoscopic appendicectomy. So it's very, very specific to the problem you are assessing. And the research question is a very important question because that's what determines what the main thrust of your study is. Okay. And research objectives. Usually you have a single primary objective and you have 2 to 3 secondary objectives. Try not to have too many objectives because every objective must have an outcome or a result. Remember, at the end of the day, when you have results, we actually go back to your objective and ask you, have you actually answered the research objectives you had? To evaluate something other, to evaluate the rate of skin infections, to evaluate the cultures of the skin infection. So you must tell us at that end of the at the end of your results, what is the rate and what is the cultures you got. If whatever you put in the objective must be reflected in your results section. You must be very clear with your method. You must tell us what the study design is, whether ethics has been approved, what type of sampling technique you use, what was the sample size. As I mentioned, a lot of people are very worried about sample size. You always worry that we're going to ask you very detailed questions about sample size. If you have already defended your sample size previously, I don't think we go into too much details here, okay? But we may ask you, where did you get your alpha error, beta error? Where did you get the difference in the 2 sample sizes? Why did you pick the sample size? That is more to understand your understanding of your own research, not so much for the thesis itself, okay? You must give us a detailed description of the measures and the instruments you use to measure them, and what kind of procedures you use to collect the data, as well as the fund or grant if that was included, okay? The best way to present your method, especially in the final defense, is through a consort diagram. A consort diagram includes a lot of the things I told you earlier. It tells us And again, some of you all have this misconception that consort diagrams are only for randomized control trial. No, it's not. You can use a consort diagram for any trial, whether it's retrospective, prospective, because all you're telling me is in the consort diagram, you're telling me how many patients were collected, how many were excluded and why they were excluded, and then subsequently how many were analyzed and what was your final analysis about. And this gives me the whole methodology in one simple diagram. And remember, surgeons are very, they use the left brain quite a lot. They would rather see pictures rather than listen to words or read words, okay? So try to put them in pictorial forms if you can. Oh, sorry. Yeah, I talked about this earlier, sample size calculation. Again, as I said, as long as you have already defended this and have been approved in your previous defense, we will not go into detail. What we may ask is more to find out your understanding of how sample size was calculated rather than the detail of how you did it in this case. And finally, results. You have to show us your demographics, the clinical characteristics, as well as the objective of your study. Either how did you actually analyze your study objective? Did you use a t-student, an ANOVA, regression, area under curve, whatever you used? And preferably these results are presented in a table form, okay? And please remember, as I told you earlier, every outcome measure must be demonstrated. That means, every objective must have an outcome measure. So if you had 3 or 4 or 5 objectives, every one of them, you must show us what was the outcome. So this is a typical result segment, result table. So if you want to show us the characteristics, you must show us in a table form with the p-value, okay? And make sure the table is legible. Don't make the table so tiny. Don't put multiple tables in one PowerPoint where you actually, it's so obscure that we can't really see what is important. If you want to highlight something, in this table itself, you can actually put highlight it or put a box around it or something to actually point out the specific areas where it is actually the p-value is significant, or you want to bring it up as a significant result from your study. When it comes to discussion and conclusion, you must restate your problem again. You must summarize your conclusions, and you must describe the support for the study's conclusion in comparison with existing literature. So in this case, you bring back your previous literature. So the previous paper said such and such, and now your study either supports it, refutes it, or has thrown the previous results, has gone against the previous results. So you must tell us what has happened in comparison to previous results and how, why it happened. You must explain to us at least a postulation of why you think something has happened. You must describe to us your own study's generalizability as well as the study limitations. All this must be included in your presentation. And finally, you must accept or reject a null hypothesis if you have presented a null hypothesis. You can describe new research questions generated as well as make final recommendations based on the study's data. So let's say your study was on superficial skin infection and the use of antibiotics. You can make a final recommendation saying that based on our study in UMMC, the culture reveals that the best sensitivity is to cefalexin. So I would recommend in the future all appendix patients get cefalexin rather than cefuroxime or any other one. So you are actually making a recommendation based on your study. Okay, and that is an impressive way of finishing your presentation. Okay, of course, please acknowledge all the assistance you received, including your supervisors, co-investigators, advisors, statistician, CRC, or funding body, surgical research unit if you use them, because a lot of the times you do use people like you do go to people like Dr. Gauri, Dr. Jasmine, Dr. Tanya, etc. So you have to acknowledge the help you have received. Okay. And finally, Turnitin is essential. It must be less than 20%. If it is more than 20%, don't even bother coming because it is an automatic fail. Okay. Please do avoid plagiarism, and you must defend your findings. That's why it's called a defense. Remember, you're coming in there, we are going to ask you questions about why certain things are such way, and you must be able to defend them. Otherwise, if you can't defend them, then there's no point, it's not, there's no point coming for a final defense. So this is confidential, how should I put it? This is a confidential information. Yeah. Sorry, is someone trying to speak?
No, I think someone entered. Okay. If you're not trying to speak, mute yourself.
Yes, please. Okay, so this is basically our assessment criteria. I am showing it to you because there's nothing hidden about this. It's not secret, okay? We are trying to be as transparent as possible. Basically, what happens is we assess your final criteria based on this list of items. So does your title cover the study purpose, design, cohort, duration, etc.? Is it clear? Is your introduction, your problem definition clear? Literature review, is it relevant and adequate? The methods, are they appropriate and correctly implemented? The results, are the descriptions and interpretations correct? And the discussion, does it make sense? What are the strengths and weaknesses? So what and what next? As well as the appropriateness of the conclusion, the turn-in analysis. We also assess you for your slide design and presentation, and your thesis format, your actual written up thesis format in the soft copy. You have to have all satisfactory. If you have at least one unsatisfactory, it's considered a minor revision. If you have more than one unsatisfactory, it is considered major revision. So the decision are usually categorized into 4 categories. Accepted, that means you don't have any revisions, it's accepted as it is. Or you have minor revision where you have at least one unsatisfactory criteria, or you have a major revision where you have more than one unsatisfactory criteria, in which case you will have to come back in and redefend in 2 weeks. And finally, you have a failed thesis where the panel actually thinks what you have done is inadequate or inappropriate, or they think you have not understood your own research well enough, in which case you will be extended for 6 months. So that is my presentation.